Hey everyone, and welcome to another deep dive with us. Today we're going to be taking a really close look at Ehlers-Danlos syndromes, specifically hypermobile EDS, or H-EDS for short, and its very close relative, hypermobility spectrum disorder, which is sometimes also called HSD. And you might be here today because you are personally dealing with EDS, or maybe you're just curious about it. Or maybe you're even a healthcare professional and you're just brushing up on the latest research. But whatever the reason is that you are here today, we are diving deep into a stack of research and articles, including some great insights from the Ehlers-Danlos Support UK to break down what's really important to know about EDS.
Yeah, what's really fascinating about this deep dive is that we're going beyond, just the bendy joints that people often associate with EDS. We're uncovering how HEDS and HSD can actually impact your entire body in ways you might not expect.
Yeah, get ready for some aha moments, because we're going to be talking about the connection between EDS and things like digestive issues, POTS, even your mental health. And we'll explain all those terms as we go along, of course. But first things first, let's break down what EDS actually is.
So EDS is a group of genetic disorders that affect your connective tissues. Now, connective tissue is kind of like the scaffolding of your body. It's in your skin, your joints, ligaments, tendons, everywhere, really. And in EDS, these connective tissues are, for lack of a better word, faulty.
Okay, so faulty connective tissue. What does that actually mean for someone with HEDS or HSD?
Well, it means your joints might be more flexible than usual. We're talking way beyond double jointed. And your skin might be super stretchy. And this tissue fragility also means that your tissues are more prone to injury. And they just don't heal as quickly.
I see. So I'm starting to see how seemingly simple joint flexibility can lead to a whole cascade of other problems.
Yeah, that's exactly it. And these additional problems are what we call comorbidities, conditions that often occur alongside EDS. Now, sometimes the connection between EDS and these other conditions is a bit of a mystery. We don't always know the exact cause and effect, but understanding these comorbidities is crucial for managing your EDS effectively.
It's like having all of these puzzle pieces, but not knowing exactly how they fit together yet. But we can start to see some patterns emerging, right?
Absolutely. And those patterns are incredibly valuable. They can give us clues about how to approach treatment and improve our overall well-being.
Okay. All right, so let's get into some specifics. Let's take a tour of the body and explore how HEDS and HSD can show up in different systems. I have to say, I was really surprised by how interconnected everything is.
You and me both. It's truly fascinating how EDS can touch so many different aspects of your health. Should we start with the most obvious one, the musculoskeletal system?
Let's go for it. We all know about the, double jointedness, but it's so much more than that, isn't it?
It really is. Think about it. If your joints are hypermobile, they're not as stable as they should be. So you might experience dislocations or even subluxations, which is kind of like a partial dislocation, where your joint slips out of place but not completely. And all of that can lead to chronic aches and pains.
That's a game changer. I never thought about it in terms of joint stability before. And I imagine all that instability puts a lot of stress on your muscles too, right?
You're exactly right. People with EDS often experience muscle weakness and fatigue. It's like your muscles are constantly working overtime to compensate for the lack of stability in your joints. And that can make everyday activities a real challenge.
And we're just talking about the joints and muscles so far. I'm already seeing how this can have a ripple effect throughout your whole body.
Well, speaking of joints, let's not forget about your spine. EDS can also impact spinal stability, leading to conditions like scoliosis, which is a curvature of the spine, or kyphosis, which is that rounding of the upper back that you sometimes see. And then there's TMJ dysfunction, problems with your jaw joint, which can also be more common in people with EDS.
Wow, okay, so we've got the joints, muscles. It's fine. It's like a whole body domino effect. But wait, how does EDS tie into the nervous system? That one's a real head scratcher for me.
It's a fascinating connection for sure. One of the most common neurological conditions we see alongside EDS is something called POTS. It stands for Postural Orthostatic Tachycardia Syndrome. It's a mouthful, I know.
Definitely. Break that down for us. What exactly is POTS?
Essentially, it's a malfunction of your autonomic nervous system, the system that controls all those automatic functions in your body, like heart rate and blood pressure. In people with POTS, simply standing up can trigger a rapid increase in heart rate, often accompanied by dizziness, lightheadedness, and fatigue.
So imagine feeling like you're constantly on the verge of fainting, just from getting out of bed. That's got to be incredibly disruptive to your life.
Absolutely. And POTS is just one example of what we call dysautonomia. Dysautonomia is a broader term for problems with the autonomic nervous system. It can impact a whole range of bodily functions, from temperature regulation to digestion, even bladder control.
So we're talking about the things your body is supposed to do automatically, without you even thinking about it. And when those systems go haywire, it can really impact your quality of life.
Speaking of things going haywire, let's talk about another area that EDS can impact, the digestive system.
Okay, this is where things get really interesting for me, because I've always struggled with digestive issues. So how does EDS tie into all of that?
Well, for one thing, EDS can lead to what's called dysmotility. It basically means your digestive system is moving a little slower than usual.
So it's like a traffic jam in your intestines. Food isn't moving through efficiently, and that's where the problems start.
That's a great way to put it. And this sluggishness can contribute to a whole host of digestive issues. We're talking irritable bowel syndrome, or IBS, gastroesophageal reflux disease, which is also known as GERD, even difficulty swallowing, which doctors call dysphagia.
And hernias. Don't forget about those.
Right. You are more prone to hernias with EDS because of those weaker connective tissues. And then there's the whole world of food intolerances, which can add another layer of complexity to managing EDS.
And if any of this is sounding familiar, don't worry. We'll be diving deeper into managing these issues later. But for now, let's keep moving. What about the neurological system? What else should we know about EDS in the brain?
Well, we've already touched on POTS and dysautonomia, but there's also chronic fatigue syndrome, which can be absolutely debilitating. And sleep disorders are incredibly common in people with EDS, whether it's insomnia, sleep apnea, or a combination of both.
And I bet those sleep problems just compound the fatigue,
Yeah.
creating a never-ending cycle.
Exactly. Then there's the issue of chronic headaches and migraines, which can be triggered by muscle tension, joint instability, and even changes in blood flow.
It's not just about the physical pain. It's the impact that that pain has on your mental and emotional well-being, too.
You're absolutely right. And that brings us to another important point. People with EDS are at a higher risk of developing anxiety disorders, depression, and even other psychiatric conditions.
It makes sense when you think about it. Constantly dealing with pain, fatigue, and these unpredictable symptoms, that takes a toll on anyone.
And then there's the social aspect of it, too, the isolation that can come from having a chronic condition that many people just don't understand.
That's why finding a supportive community is so crucial. Whether it's a support group or just connecting with others who get it, it's a reminder that you're not alone.
Speaking of things that are often misunderstood, let's talk about something called small fiber neuropathy.
Okay, what in the world is that?
It's a type of nerve damage that specifically affects the small nerves responsible for sensations like pain, temperature, touching, and it can cause all sorts of strange symptoms. Burning pain, numbness, tingling, even changes in your skin color.
That sounds incredibly uncomfortable. And I bet it's hard to diagnose, too, since the symptoms are all over the place.
It definitely can be a challenging diagnosis, often requiring specialized testing. And one last point on the neurological front, there's some emerging evidence that neurodevelopmental differences like ADHD and autism spectrum disorder might be more common in people with EDS.
Whoa, that's fascinating. It really highlights just how interconnected everything is.
It's an area that definitely needs more research, but it's something to keep in mind if you or someone you know has EDS and is also experiencing neurodevelopmental challenges. Now, before we move on, I want to mention one more neurological condition that's sometimes linked to EDS, mast cell activation disorder, or MCAD for short.
Okay, I've heard of MCAD, but I'm not quite sure what it is. Can you give us a quick explanation?
Of course. So mast cells are part of your immune system. They release chemicals when triggered, and those chemicals can cause allergy-like symptoms, like hives, itching, swelling, and flushing.
So MCAD is basically your mast cells going a little crazy and overreacting to things.
That's a good way to think about it, and we still don't fully understand the connection between EDS and MCAD, but it's thought that the weaker connective tissues in people with EDS might contribute to mast cell instability. So it's another one of those pieces of the puzzle that we're still trying to figure out.
Okay, so we've covered the musculoskeletal system, the nervous system, you even touched on the immune system a bit. We haven't even gotten to the cardiovascular system yet.
You're right. Let's head over to the heart. We already talked about POTS, which has a direct impact on your heart and blood vessels. But there are a couple of other things to keep in mind when it comes to EDS and your cardiovascular system.
All right, fill us in. What else should we be aware of?
One is aortic root dilation. It's a widening of the aorta. That's the main artery that carries blood from your heart to the rest of your body.
That sounds scary. How serious is aortic root dilation?
It can be a serious condition in some cases. But the good news is that with H-EDS, It's usually mild
Hmm.
and doesn't require treatment. It's just something to be aware of and to have your doctor monitor.
Prevention is always key. And what about mitral valve prolapse? I've heard that might be connected to H-EDS too.
So the mitral valve is one of the 4 valves in your heart, and it helps regulate blood flow between different chambers of your heart. Mitral valve prolapse means one or both of the valve's leaflets, those little flaps that open and close, don't close properly,
Yeah.
allowing some blood to flow backward.
So it's like a leaky valve, basically.
Correctly. And while it can cause problems, many people with mitral valve prolapse don't even experience any symptoms.
Okay, so does that mean it's more common in people with H-EDS or not?
Well, the jury's still out on that one. More research is needed to figure out if there's a definitive link, but it's definitely something doctors are looking into.
All right, so we've covered a lot of internal systems, but let's not forget about the largest organ in your body, your skin.
Ah, yes, the skin. EDS can make your skin pretty unique, that's for sure.
Unique is a good word for it. People with EDS often have hyperextensible skin, right? Meaning it's super stretchy.
Exactly. And they're also prone to easy bruising, poor wound healing, and abnormal scarring.
I can imagine that must be frustrating.
Huh.
A simple bump or scrape could turn into a major ordeal.
It definitely can complicate things, but sometimes the stretchy skin can be kind of cool too.
Guess you've got to find the silver lining wherever you can. Okay, moving right along. What about the bladder? How does EDS affect that?
Well, since EDS affects those connective tissues that support your bladder, it can lead to bladder dysfunction. You might have difficulty urinating, or need to go more often, or even experience incontinence.
I see how that could be uncomfortable and embarrassing.
It can be a real challenge for sure. And it's not always directly caused by EDS, but it's definitely something to be aware of if you're experiencing bladder issues.
Okay, before we move on to the final,
Yeah.
but incredibly important, topic of mental health. Let's quickly touch on 2 more areas.
Yeah.
Dental oral health and MCAD.
Right, those are both worth mentioning. So with dental health, people with EDS are more prone to TMJ issues, which is short for temporomandibular joint dysfunction. It can cause jaw pain, clicking, popping, even dislocation of your jaw.
I've heard that TMJ problems can be a real nightmare. And I've also heard that the pain can radiate throughout your face and head too.
Exactly. It can be incredibly debilitating. And as for MCAD, remember those mast cells we talked about earlier? Well, MCAD is basically an immune system dysfunction, where those mast cells are overreacting, releasing chemicals that cause all those allergy-like symptoms.
So we're talking hives, itching, swelling, all those fun things.
That's right. And again, the exact connection between EDS and MCAD isn't fully understood, but there seems to be a link.
So it's another one of those puzzle pieces that researchers are still trying to put into place.
That's a great way to put it, and it definitely highlights the need for more research in this area.
All right, we've done a whirlwind tour of the body, highlighting all the systems that can be affected by EDS. But now let's shift gears and talk about something that's absolutely crucial, your mental health.
You're absolutely right. Recognizing the mental health aspects of living with a chronic condition like EDS is paramount. It's about addressing the whole person, not just the physical symptoms, but also the emotional, psychological, and social aspects.
It's so important to acknowledge the mental and emotional challenges that can come with EDS, and to know that it's okay to ask for help.
I completely agree. And that's actually where we're going to pick up today, exploring all the different ways that you can manage EDS and improve your quality of life.
I was really inspired while I was prepping for this part of our deep dive. It's amazing to see how much people can do to take control of their health and well-being.
Yeah.
Even with a chronic condition like EDS.
Absolutely. And the key is taking a holistic approach to EDS management. We're not just talking about treating the physical symptoms, but also addressing the emotional, psychological, and social aspects of living with this condition.
So where do we even begin? What are some of the most effective approaches for managing EDS?
Well, physical therapy is often considered the cornerstone of EDS management.
That makes a lot of sense to me. If your joints are hypermobile and prone to injury, strengthening the muscles that support those joints has got to be a good first step.
Precisely. A skilled physical therapist can create a customized exercise program just for you. They'll target your specific areas of weakness, improve your balance and coordination, and teach you the proper body mechanics to minimize strain on your joints.
So this isn't your average gym workout. We're talking about exercises that are specifically designed for people with EDS.
Exactly. And it's not just about strength training either. Physical therapy can also incorporate things like massage and heat or cold therapy to help manage your pain
So it's a really well-rounded approach. And along with physical therapy, I've heard that occupational therapy can play a big role too.
That's right. Occupational therapy focuses on helping you adapt your daily activities and your environment. It's all about conserving your energy, minimizing strain on your body, and ultimately improving your overall functionality.
That could involve things like learning new techniques,
Yeah.
for getting dressed, or taking a shower, right? Or maybe using assistive devices to make certain tasks less challenging.
That's exactly it. And occupational therapists can also help you with things like energy management and pacing, which are so important for people with EDS, who often experience fatigue.
I love that approach. It's all about empowerment. It's about helping people live their lives to the fullest, even with limitations.
It's all about finding ways to work with your body, not against it. Now let's talk about pain management, which is a big concern for many people with EDS.
Yeah, because living with chronic pain can really wear you down, both physically and emotionally.
You're absolutely right. And the thing about pain management is that it's very individual. What works for one person might not work for another. It's all about finding the right combination of strategies that provides the most relief for you.
Okay, so what are some of the options that people can explore?
Well, for mild pain, over-the-counter pain relievers,
Yeah.
like acetaminophen or ibuprofen, might be enough.
But for more severe pain, prescription medications might be necessary.
That's right. And there are so many different types of pain medications available, so it's really important to work closely with your doctor to find the one that's most effective and has the fewest side effects.
And there are also complementary therapies, like acupuncture or massage. That might be helpful for some people.
That's true. But it's important to remember that not all complementary therapies are safe or appropriate for everyone with EDS, so it's always best to talk to your doctor before trying any new treatments.
Always a good idea to get that professional guidance. Now let's switch gears and talk about managing autonomic dysfunction. Those issues with the nervous system that we talked about earlier, like POTS.
Right. If you're dealing with POTS or other forms of dysautonomia, there are specific things you can do to help manage those symptoms.
Like increasing your salt and fluid intake. I've heard that can be helpful for regulating blood pressure.
It can be. And a graduated exercise program can also be really beneficial. That's where you slowly and gradually increase your activity level to help your body get better at regulating blood pressure and heart rate.
It's important to start slowly.
Yeah.
And really pay attention to your body signals, right? Pushing yourself too hard can actually make things worse.
Exactly. It's all about finding that sweet spot where you're challenging yourself just enough to make progress, but not so much that you overdo it. And sometimes medications might be necessary to manage heart rate and blood pressure.
So it's another multifaceted approach involving lifestyle changes, exercise, and possibly medications.
Precisely. And again, it's all about working with your doctor to find the combination that works best for you. Now let's circle back to a topic that's woven throughout everything we've been discussing, mental health.
It's so important to remember that living with a chronic condition like EDS can have a big impact on your mental well-being.
It's true. And it's absolutely essential to acknowledge those challenges and reach out for support if you're struggling.
What are some of the best ways to address the mental health aspects of EDS?
Well, therapy can be incredibly helpful.
That could be individual therapy, group therapy, or a mix of both.
Exactly. And there are so many different types of therapy available. One that can be particularly helpful for managing anxiety and depression is called cognitive behavioral therapy, or CBT. It helps you identify and change negative thought patterns and behaviors.
And I imagine support groups can also be really valuable for people with EDS.
Oh, absolutely. Connecting with others who truly understand what you're going through is so validating and empowering.
It's that reminder that you're not alone. And it's a safe space to share your experiences, get advice from people who've been there, and just feel supported.
Exactly. And don't underestimate the power of other stress-reducing activities. Things like mindfulness techniques, relaxation exercises, even just spending time in nature can be really beneficial.
It's all about finding what works for you and incorporating those practices into your daily routine. And, you know, we've talked a lot about specific therapies and treatments, but I think it's important to mention that lifestyle modifications can also make a big difference.
That's a great point. Lifestyle changes can be incredibly empowering because they give you a sense of control over your health.
Okay, So let's get practical. What kind of lifestyle changes are we talking about?
One of the most important things you can do is learn the art of pacing.
Pacing. I'm picturing someone pacing back and forth nervously.
Not quite. Pacing in this context is about balancing activity with rest.
So it's about listening to your body's signals.
Right.
And not pushing yourself beyond your limits.
Exactly. Because if you overdo it, you can end up with more pain, fatigue, and even injuries. Pacing is all about finding a sustainable rhythm that allows you to do the things you enjoy without crashing and burning.
It's like finding that Goldilocks zone. Not too much, not too little. Just right. And ergonomics plays a big role too, right?
Absolutely. Ergonomics is all about making sure your environment is working for you, not against you. It's about designing your workspace, your home, even the way you move, in a way that minimizes strain on your body.
So making sure your workspace is set up properly, using supportive pillows and cushions, even just wearing the right shoes can make a difference.
Exactly. Little changes can have a big impact. And there are tons of resources available to help you create a more ergonomic environment at home, at work, even when you're traveling.
It's about setting yourself up for success.
Yeah.
So we've got pacing, ergonomics. What else should we keep in mind?
Well, diet can also play a role in managing EDS.
You're talking about food sensitivities and intolerances.
Right. While there isn't a specific EDS diet, some people find that certain foods can trigger or worsen their symptoms.
So it's about paying attention to how your body responds to different foods and making adjustments accordingly.
Exactly. Keeping a food diary can be a really helpful tool. You can track what you eat and how you feel afterward. And that can help you identify any potential triggers.
I'm seeing a theme here. It's all about being mindful and tuning into your body's signals. We've covered a lot of ground in this section. Physical therapy, occupational therapy, pain management, autonomic dysfunction management, mental health support, pacing, ergonomics, and even dietary considerations.
It can feel overwhelming at first, but it's important to remember that you don't have to do everything at once. Just start with one or two things that resonate with you and go from there.
It's a journey, not a race. And it's about finding the right combination that works best for you.
Absolutely. And you don't have to go through this journey alone. There are so many resources available to support you, from healthcare professionals, support groups, to online communities.
Connecting with others who understand can make all the difference in the world. It can help you feel less isolated, more empowered to manage your condition, and just remind you that you're not alone in this.
That's so important. And before we wrap things up, I want to emphasize one final but incredibly important point: the power of self-advocacy.
Yes. If you're living with EDS, you are your own best advocate.
Exactly. You know your body better than anyone else. So speak up for yourself. Ask questions. And don't be afraid to push back if you feel like you're not being heard or taken seriously. It's your health, and you deserve to be treated with respect and understanding.
It's about being an active participant in your healthcare journey.
And seeking out information and support, too. Don't hesitate to get a second opinion if you need to, and never stop learning and advocating for yourself.
We've covered so much in this deep dive. We started by unraveling the mysteries of EDS and all its potential ripple effects throughout your body. Then we explored the wide range of approaches you can use to manage your condition and improve your quality of life. And we've really emphasized the power of knowledge and connection in navigating this often complex world of EDS.
Yeah, we've laid a solid foundation for you. But the learning doesn't stop here. This is where you take the reins.
Exactly. So I want to leave you with a question to ponder. Knowing what you know now about EDS and its potential impact on all these different areas of your health, what aspect are you most curious to explore further?
What's so fascinating is that we've only just scratched the surface here. Maybe you're intrigued by that connection between EDS and the nervous system, or perhaps you want to delve deeper into managing chronic pain, or maybe you're just fired up about advocating for more research and awareness.
It's really about making this knowledge your own.
Yeah.
And remember, there are tons of resources out there to support you on your EDS journey.
The Ehlers-Danlos Society is a fantastic place to start. They've got a wealth of information, research updates, and support networks, all dedicated to improving the lives of people with EDS.
They're an incredible resource. And don't forget about the power of connecting with healthcare professionals who specialize in EDS. They can give you personalized guidance, help you navigate that often tricky diagnostic process, and create a treatment plan that's truly tailored to your unique needs.
Finding the right healthcare team can be life-changing.
So as we wrap up this deep dive into the world of Ehlers-Danlos syndromes, remember this: knowledge is power. The more you understand about EDS, the more equipped you'll be to manage your condition. advocate for your needs, and live a full and meaningful life. Keep asking questions, keep learning, and most importantly, keep connecting with others who understand.
And here's one final thought to leave you with. How can you use this newfound knowledge to make a positive impact? It could be for yourself, your loved ones, or even the wider EDS community. Every voice makes a difference.
Thanks for joining us on this deep dive. Keep exploring, keep learning, and until next time, keep diving deep.